Okay, so let us start with case three. Five people experienced gastrointestinal pain, vomiting, and diarrhea 1 hour after eating heated potato salad at a picnic. After around 18 hours, the symptom subsided. Now, what is the most likely diagnosis? What are the probable causative agents? How they do pathogenesis? What are the investigations and clinical features that are there to diagnose the condition? As well as what is the treatment and what is the prevention plan? So, here, as you can see, person has developed all these GI symptoms, especially this vomiting after 1 hour. And there are only two conditions which can do this. One is S. aureus, and second is Bacillus cereus. So both of these they do food poisoning and both have shortest incubation period time. But out of this, the shortest one is Staphylococcus aureus, that is 1 hour. So that's why the answer here is Staphylococcus food poisoning caused by Staphylococcus aureus. Now let us see the pathogenesis. So first of all, the food handlers, they have the Staphylococcus aureus bacteria on their hands. And these bacteria, they release these heat stable toxins. And there are total 15 serotypes, A to E and T to P, out of which the type A is the most common type. Type F does not cause food poisoning, but it causes the toxic shock syndrome, which we have discussed in case one, if you can recall. Now, the preformed toxin will contaminate the food, and the food items which are usually animal or dairy products like ham, poultry, or potato, salad, mayonnaise, pastries, dairy. So this type of foods they are usually contaminated with Staphylococcus aureus. And if you ingest this food which is already contaminated with this toxin, and this toxin is basically a neurotoxin. It will stimulate the vagus nerve as well as the vomiting center in your brain. And that will stimulate the peristalsis in the intestine. And that leads to vomiting and diarrhea. And this all thing will happen within a very short period of time, that is 1 to 6 hours. So here, as you can see, the incubation period was 1 hour. That's why the answer is Staphylococcus aureus. And that will lead to nausea, vomiting, abdominal pain, and occasionally diarrhea. But interestingly, if you see, there will be no fever because there is no infection. This is a toxin mediated condition. And due to this continuous vomiting and diarrhea, a person may develop dehydration, but it is usually, mostly, it is self-limited condition. It will get recovered in 8 to 24 hours. So differential, I already told you that in less than 6 hours, if anyone is causing food poisoning, then you have to think only two bacteria, that is Staphylococcus aureus and Bacillus cereus. Incubation period is 1 to 6 hours for S. aureus and 2 to 6 hours for Bacillus cereus. So here, if it is 2 hours, 3 hours, 4 hours, or 6 hours, I cannot definitely tell that it is which bacteria which is causing it. Then I have to rely on the symptoms. Because in Staphylococcus aureus, there is diarrhea plus vomiting, while Bacillus cereus can do this shortest incubation period food poisoning, but it is usually emetic food poisoning, so only vomiting will be there. So first clue, obviously, it is the 1 hour incubation period here. Second, diarrhea was also present along with vomiting, but in Bacillus cereus, only vomiting will be predominant. And the third thing which help you to reach to the diagnosis is the item which is getting contaminated. So here potato salad was there, but meat or dairy products, they're usually contaminated with S. aureus. And in Bacillus cereus, the classical case they usually give is usually contaminating the rice, especially the fried rice, or they say that fried rice in a restaurant person has eaten and soon will have developed this type of infection. So that was about pathogenesis and differential diagnosis. Let us look at which investigation can help us to confirm our diagnosis. So you take the food items which are suspected and you detect these enterotoxins in them using either serological tests like ELISA or latex examination, or you can take the food and you do PCR and you detect the gene of this bacteria. But again, it is a self-limited condition, so treatment is usually supportive, and to prevent dehydration, only fluid and electrolyte replacement is needed. No antibiotic is required for recovery. It is a self-limited condition. So do not prescribe any kind of antibiotic if you suspect that it could be Staphylococcus aureus, food poisoning. Prevention, obviously, if hand hygiene of a food handler is improved, then this condition can be prevented. So that's all for this case today. I hope you enjoy this video that I'm making for case-based microbiology. And if you want to read this book, the book is available on qworld.co.in as ebook. It's also available as a Kindle platform on Amazon. And if you want to buy a paperback version, that is also available on the Amazon. Thank you for watching this video, and stay tuned and subscribe to the channel for regular updates and videos that I post. Thanks.